Hello, friends. I hope you all are good. We are going to discuss about the laboratory animals. So, let's discuss the introduction. Animals are widely used experimentally in almost every laboratory where a biological study is needed. In pharmacological research, animals are being used to test the effect of drug before their introduction to clinical trials, where drugs are tested on humans. In addition, animals are used in educational institutions also to demonstrate the effect of drugs or for the teaching purpose. The experimental animals should always be suitably bred, gently handled, and properly used. Let's discuss the ethical and legal responsibilities. A careful handling of animals in such a manner that they do not suffer from unnecessary pain. They should give we should give good care towards the health and well-being of the animals, and it's important that animals they are aware of the handler's presence before attempting to restrain them, particularly if the animal is initially asleep. This will reduce stress for the animal and help to avoid bite injuries. Let's discuss about the animal house. Diurnal light cycles in animal holding rooms control temperature, controlled humidity, free access to water, ad libitum and chow diet adaptation period. So these are all the utilities, or we can say, we need in animal house. So these are the cages you can see. Now we will discuss about the selections of an experimental animal for a particular experiment depends on. So it depends on nature of the experiment, the type of drug activity which is to be evaluated, the specific character of experimental animals. Animal can be used in vivo experiments when the whole intact animal is used, or in ex vivo experiments when only a part of the animal is used. This part could be a heart, uterus, trachea, etc. A tissue like skeletal muscle, or even some cells, like example blood cells. So the type of animal which we should use are large category or small category. In large category we can say monkey, pig, dogs and cat, and in small category we can say mice, rats, rabbit and frog. For teaching purposes the small animals are commonly used, and we can say the most probably used animal is Vistar rats, albino Vistar rats. Now we'll discuss about the selection of the species depend on many factors, that is a technical issue, any animal husbandry issue, public concern about use of certain species, and financial consideration. In technical issues, example availability of the species and numbers needed, health and genetic status of the species, animal size and volume of blood required. In animal husbandry issues, example availability of the suitable housing, ease of handling of the animals, training and level of competence of personnel. Types of experimental animals are mouse, rat, guinea pig, and rabbit. Let's discuss about the mice. The most common mammal among laboratory animal is mice. The characteristic of the mice are small laboratory animal weighing about 18 to 30 kg. They are very sensitive and consume small dose of drug. They can be easily handled, highly exploring and mobile, that means moving. Drugs are best injected intraperitoneally or intravenously into one of their superficial tail veins. Uses in research of mice are in cancer, in genetic research, in acute toxicity studies, in screening of various drug activities, especially central nervous system activity. So, by this, we can discriminate between the male and a female mouse. So we can say the distance between the anal and the genital orifice is greater in male and as compared to the female. Now handling of restraint of mice. How we will handle mice? Instruction: gently but firmly. Wear disposable gloves. These are the instructions. Wash your hands. Wear a clean laboratory coat. Handling and restraint of mice. The animal they should be grasped by the tail. So this is the handling procedure of the mice, that we should grasp by the tail and should then be placed on a rough surface such as cage top while holding the tail firmly. To carry the mouse for injection, you can use one-handed or two-handed method. What is one-handed method? Place the mouse tail between the last two fingers of the hand that's holding the nape. Two-handed method is the scruff can be grasped between the thumb and the forefinger, which maintaining a grip on the tail. Injecting the mouse, now we'll see the intraperitoneal injections. They can be made into lower quadrant of the abdomen, that is intraperitoneal. Subcutaneous injections are subcutaneous injections. They can be made into the scruff of the neck. Care must be taken to direct the needle into the scruff and not in the handler's finger or thumb, so we have to inject it very carefully. Intramuscular injections, they can be made into the quadriceps muscles group on the anterior of the thigh. Genetically modified mice, that is knockout mouse. It's a genetically engineered mouse in which researchers have inactivated or knocked down an existing gene. It can cause a change in a mouse phenotype, that is appearance, behavior, physical or biochemical characteristic. It is a very important animal model to study the role of genes that have been sequenced but whose function haven't been determined. Causing a specific gene inactivation and observing any differences from normal behavior or physiology, we can infer its probable function. And it's also used to test the efficacy of a new drug. So this is the newt mouse. Mouse from a strain with genetic mutation cause a deteriorated or an absent thymus, resulting in an inhibited immune system due to greatly reduced number of T cells. The phenotype of the mouse is lack of body hair, newt nickname, valuable in research, and it can receive different types of tissue and tumor graft, that is known as xenograft, with no rejection response. Now let's discuss the characteristics of the rat. They have a larger weight than mice, about 300 to 500 gram. They can withstand long periods of experimentation under anesthesia. They can be easily handled if treated kindly. Drugs can be injected IV into the tail veins subcutaneously and intramuscularly or intraperitoneally. They can also be given drugs orally by means of stomach tube. Isolated preparation can be taken from them easily. Now let's discuss about the proper method of handling. To initially restrain a rat, the handler should gently grasp its around the shoulder. The handler's thumb can then be placed under the rat's mandible to prevent bite, and the rat's hind limb can be supported with other hand. Restraint should be firm but not too tight, as this will impede the animal's respiration. Note that bites from the rat are uncommon and will typically only occur if the animal is stressed or in pain. We can give IV administration in rats. Intraperitoneal injections, they may be made into the caudal half of the abdomen with the needle directed along the line of the hind leg. This is the gastric cavage. Now let's discuss the characteristic of the guinea pig. They are very docile and tame animals, very susceptible to infections and highly sensitive to actions of many drugs, example histamine and penicillin. They can't synthesize endogenous vitamin C, and this vitamin should be supplied in their diet. Some isolated muscle preparation can be taken from guinea pigs, example guinea pig vas deferens, tracheal chain or ileum. Drugs can be injected IV into their tail veins subcutaneously, intramuscularly or intraperitoneally. They can also given drugs orally by the means of stomach tube. So we can use the guinea pig for the screening of histaminic, antihistaminic drugs, respiratory or cardiovascular activities, testing the effect of drug on their isolated muscle preparation. Now you can see the handling and restraint of guinea pig. To initially restrain a guinea pig, the handler should be rapid and smooth to avoid frightening the animal. The handler's thumb is placed beneath the jaw of the guinea pig. The hindquarters of the guinea pigs are supported by the handler's other hand, as you can see. Let's discuss the characteristics of the rabbit. They are very docile animal. They can be easily injected IV into their marginal EO veins. They can be given drugs orally by means of stomach tube. Some isolated muscles preparation can be taken from rabbit. So this is the intravenous injections in the rabbit. How we can give IV injections. Rabbits, they may also be restrained for injection by wrapping the animal in a drape or a towel. If the rabbit is securely wrapped, it will not struggle. IV injections into the rabbit marginal EO veins can be readily made if the rabbit is restrained with a drape. Now you can see the handling of the rabbit. Rabbits are especially susceptible to the effect of stress, and they should always be approached in a calm and confident manner. The handler is restraining the rabbit firmly by the scruff, with the other hand ready to support the animal's hindquarter. Now let's discuss the blood sampling in the mice or rats from tail vein, orbital sinus, cardiac puncture, and saphenous vein. From tail vein, carefully warm animal with heat lamp or disposable hand warmer. Place the animal in an appropriate device. Clean withdrawal site with alcohol using a sterile blade. Nick the lateral vein as shown in this picture. Collect the blood into an appropriate container and apply gently pressure to stop the bleeding. Now this is the orbital sinus. It is used to collect larger volume of the blood. Appropriate anesthesia must be used for this procedure. Animals may receive topical anesthetic or general anesthesia. So this is the cardiac puncture blood collection. Collect up to 1 ml of blood within a short period of time. They must be performed under general anesthesia. Now this is the last blood collection from the saphenous vein. It is located along the lower portion of the hind leg. This technique is used for collecting small volume of the blood, and it can also be applied on rats and guinea pigs.